Are we ready? I thought you said you were doing the opening.
You
said here, did he say he was doing the opening?
Welcome to Sycamore Crossing. It's 53 degrees out there. The fog is just beginning to lift, and I always wear a tie, but it was so cold this morning I put my veteran's jacket on, and that's my tie, and he's got natural padding over here, so he didn't need his jacket. You see, Dr. Tidman's got a jacket on.
Was that ha-ha funny?
That was ha-ha.
Every week we give him a little stuff about that. Okay.
Okay, so
his back's better. You mean last week he didn't say a word, did he? He sat here in agonizing pain. You couldn't tell it, but he didn't say a word. Now he'll talk to you. Go, baby.
Exactly. Hey, folks, we're at Sycamore Crossing here in downtown Blue Ridge, and I'm going to say crisp. I'm saying it's a crisp,
53
beautiful
degrees,
morning.
Well, that porch.
These guys have jackets on. I should be wearing a jacket. Thank you, Georgia Cancer Specialist, Northside Cancer Center, for this segment. And we have Switzerland here with us, right?
Yeah.
Neutral.
Yeah.
Dr. Raymond Tidman and Dr. Whaley here. How are you today?
I love that one, Switzerland. He's neutral.
I don't know how to take that, though.
No, but I think that's what people tell me all the time. So, you get so daggum complicated. Like my mama, my father, and my wife always said, ask Dr. Whaley what time it is, and he'll tell you how to build a watch. And Ray comes back and tells you what time it is. And he tells you what time it is analog even, not even digital. All right.
And the Swiss are good at that.
Yeah, all right. The Swiss are good at that. By the way, that's right. That's a Swiss watch.
Swiss
all right.
watch.
There it is. There's the train bell.
Yes.
We haven't heard the.
And I want to say this because tomorrow's 9/11, so this is Ask the Doc. But while I have both of you, I would like for you to share some feelings on 9/11. And I say, we usually take September as the last month because it gets a little cool and the weather gets unpredictable. So we usually move over indoors in October. But the one of the many things, is just 1, 2, 3, 4. I have 6 flags, and I just enjoy sitting here every Friday morning. And if you know the lady that puts these out and makes it happen, can you tell her?
It's called my wife.
Oh, is that her?
It's my wife puts these. We're talking about 9/11. 9/11. I was doing physicals on the Thrasher hockey team. Captain of the team was Ray Ferraro. He was sitting on a stretcher, and he said something has hit. The news is always on there, and they're taping his knee and everything. And they always have, in a professional locker room, they've got 15 TVs on. They're usually on Sports Center and stuff. But that time of morning, our guys were watching the news, and Ray said, something has hit the World Trade Center. So we were doing the preseason physicals on the Thrashers that day. Exactly 2 weeks later, which would have been day 14, the National Hockey League shut down for a week. The first game played back in New York was the Thrashers and the Rangers. So we landed on Saturday morning at Teterboro Airport, which is right across the river from you'd see all the smoke. The Rangers met us at the airport within another bus. And they'd given all the Rangers and all the Thrashers 2 or 3 jerseys per player and a whole bunch of sticks and pucks and hats. And they took the Rangers and the Thrashers down to the site, and that would have been 13 days after it happened. It was still smoking and burning. And we got up the people. We got to meet the first responders and the people. It was still a madhouse at that moment. And then the players were all autographing their jerseys and giving them to the firemen and the police that were there. And Giuliani came out and had a statement about they were getting back to Madison Square Garden, getting back to hockey and everything. But I was very, very impressed. But as I stood there and looked across, I see the top floor of my daughter's apartment building. You've heard me tell the story. My granddaughter's apartment and bedroom was the closest residence bedroom to the 9/11 hole. They were out of that building about a year, and when they came back and I first went to visit, she took me over to the window, and she was about 4 years old then, and she said, "Granddaddy, big building's not there anymore." So 9/11 was, it was real intense for me and my family.
I am always so appreciative of the people that rush in, the people that go get the job done. And, you know, they're just quietly in the background all the time, and we don't think enough of them. But that's a special kind of person. They don't hesitate. There's somebody needs something, and they're going to go give it to them. And I think, if anything, 9/11, we should always really be honoring that spirit that's in our country.
Minimum wage.
Yeah.
All right,
All
gentlemen.
right, Chris.
All right.
I'm going to cry if we don't.
Yeah.
All right. Both of these questions today are kind of interesting, and it goes back to several things we've talked about over time. And the first one it's got a little phrase in it I'm going to let Ray jump on in a minute. My wife is 40 years old and was sent to a hematologist by her PCP for iron deficiency anemia. Now remember, she's 40 years old. She had a hysterectomy at age 30 and a gastric bypass the same year and was not anemic. She had upper and lower scopes at that time. She was not anemic 5 years ago. Here's the point. She had no labs for the past 5 years, parentheses, lost her insurance, parentheses, close. And the hematologist said she had B12 anemia, iron deficiency, and needed several different types of vitamins. Is something serious going on? He did recommend she see her previous GI doctor, and he is going to give her iron in the vein. Well, iron deficiency anemia and iron in the vein, that's just 2 weeks ago. So we beat that horse to death. But the rest of this, I think, has some really interesting features in it. And that first one is she didn't do anything for 5 years because she lost her insurance.
That's that's a common thing. And it's frustrating from a primary care perspective because, if she's got insurance, she probably has a deductible. Now they're around $5,000 a year, and she has a copay and all kinds of stuff. And she's also got a premium that she or he are paying on some part of their insurance, which is probably never less than $100 or $150 a month.
$400 a month.
Or $400 a month, or whatever. I mean, it's not zero.
It's real money, yeah.
So the notion, and this is just bad economics, the notion that, okay, well, I don't have any insurance anymore, therefore I don't have health care, is just nuts.
That's the point I wanted to make. We were talking about these people that rush into the building. Ray brought that up.
Yeah.
I think we're responsible for our own happiness, our own health. I think you choose to believe in the resurrection. I mean, you have to make a choice to believe. You have to make a choice to do this. And I think when somebody expects bottom dollar coverage in their eyes and their teeth and everything else, that they're making a mistake. I think a woman who's had a bypass, for crying in the night, ought to have been going to see the doctor. All right.
And let me interject on that, because she didn't just walk in and get a bypass one day.
That's right.
She had counseling, there are all kinds of other stuff
she went
that went
through
on.
psychiatric evaluation.
And part of that is the education about what you've got going on here, and part of that education is that you're subject to malnourishment and all these other side effects and things down the road. I mean, that had to be
they would
something she was aware of.
If she got that in the bariatric center, the head of the ethics committee of the American Bariatric Society is a friend of mine, and I've been seeing his patients for 35 years. Well, I got a ton of experience here. My daughter had one. All right, show that first picture there. I want to talk about bariatric surgery first. I mean, I'm the one guy that tells you there's no easy fix. You can't get a B12 shot and lose weight, and somebody says you got a pill. There's a new pill you can take and everything. I want you to look carefully at this thing he's got up. The person who has failed every type of diet, well monitored by a PCP, well instructed by a nutritionist, has lost 3 or 4, 5, 6, 700 pounds and gained it back, and has hypertension or diabetes, and their knees are going bad and they're double their ideal body weight, it's time to consider bariatric surgery. And that's what this first picture does here. It tells you all of the different metabolic disorders that can kill you, shorten your life, and make it miserable, and you got to do something. So it's kind of the end of the road there. Pull that down if you would. It's kind of end of the road there to consider. I'm getting ready to have my stomach operated on, and something that not 100% permanent, but you can't just reverse it by stopping the medicine. But there are people that I would suggest go get counseled about bariatric surgery. Talk to your primary care doctor about it. Talk to the bariatric surgeon about it. Then you have to go to the psychiatric and everything else. And if at the end of the day, you and your family believe that it's worth the expense, most insurance companies are now paying for bariatric surgery after you've done all those things. Go ahead and do it. Now, what's bariatric surgery? Put up the next one. This, I don't want to get to plumbing too much, but this procedure here is called a Roux-en-Y. You don't need to know what that means, but what they do is they pull the small bowel up, and if you can kind of tell that little pouch at the top is all the stomach you got left. The rest of it's off to the side. You can pull that down. Well, everybody knows that you absorb a lot of stuff in your stomach. So the first thing, this next sign, put that complication sign up. The immediate complications of bypass surgery, meaning within the first 60 to 90 days, not long term, this is 10 years, are as high as 20% that can bleed, perforate, have some big time thing. You can pull that down again. The people are so obese, they can have blood clots in their legs, they can have pulmonary embolizations. You got that off, right, Dave?
Yes.
All right, so there are a lot of immediate complications. We're not here to talk about that today, okay? We'll talk about long term. Put up that next one. All right, now, BKP, I'm gonna put you to work. You ready?
Yeah, let's go.
All right, so first of all, this is
3 years. I see it 3 years.
3 years,
Okay.
all right. Now, this is the procedure this patient had. This is the percentage of people at 3 years who have a nutritional deficiency. What's that number?
50%.
At 3 years.
All right.
Now, remember, this woman was not anemic at 5 years. What's the percentage that have a nutritional deficiency at 5 years?
87%.
Okay, you can pull that down. Now, why, if 87% have a nutritional deficiency, wasn't she anemic at 5 years? And it's easy. There is so much storage iron, so much storage B12 and all in your body that even though you have a nutritional deficiency, virtually 90% of the time, you're still working off those stores of B12 that are in your liver and everywhere else. So frequently by 5 years, you're way down, but you're not empty. So you're running on the reserve tank to get to your next gas station. All right, pull that, it's down now. So at 5 years, she was not anemic, but she was deficient. So it would have been in that next 5 years when she should have been seeing the PCP, you would have caught it. So iron deficiency, what happens there is along that suture line, you're just going to lose a little tiny bit of blood every day. Everybody loses blood in their GI tract every day. If you just think about the inside of your mouth, you bite it every once in a while, you burn it with a pizza, you got 22 feet of that type of mucosa between this end and that end, and it doesn't take much imagination to believe that that can just slough off a little bit of blood all the time. Well, if you lose this much blood every day, you don't get anemic. But you can only absorb this much iron every day, even if you're taking big old iron pills, and her stomach's gone. So you could give her all the iron pills in the world, she's not going to absorb that iron. Now, the other things that are on this list, and there's a list that's a mile long. These people, I'm going to show you at the end, they get calcium deficiency, they get magnesium deficiency. Vitamin A is a big one. The next one's folic acid. That's the vitamin that's in what do you call it? Prenatal vitamins that keeps you from getting spinal babies. And then B12. B12, you got to have a stomach that produces intrinsic factor, and well, you just bypass that with the surgery. So, where the doctor said, what the doctor say? He's got what the question say? She needed several different types of vitamins. So that's going to be this folic acid and everything else. Put up that next picture there. Now this next picture here, folic acid that I mentioned just a minute ago, it comes in lettuce and a bunch of stuff like that, and that people don't ever think about folic acid.
It's in green anything.
Yeah, but when you're iron deficient and you start giving iron back and you're making blood fast, you start sucking that folic acid up. If you're B12 deficient, you get B12 and start making blood, you're sucking up that folic acid. So hematologists are frequently going to prescribe folic acid to people with a normal folic acid level when they're fixing their anemia from something else. And lots of surgeons, if you had a big blood loss at hip surgery or something, will start you on these acids. So anyway, folic acid, if you don't have it, you feel like you got the belches and stuff. Your brain can go soft. It fixes your heart, and lots of stuff on that thing of folic acid. Now pull that one down. Now the last picture there, put that tooth up there. Now why in the world have I got a tooth up there when we're talking about bypass surgery?
I don't know.
You do. You know too.
What?
Dentists look in the mouth, and the mouth is a big
Mirror.
Big opening to your whole blinking body.
Okay.
And there's a dentist right across the hall from him who's young, strong looking guy. I've got patients I see for him maybe 2 or 3 a year, maybe more than that. He'll call up and say, this patient looks like they have some sort of bone absorptive disorder that's not due to decay or using methamphetamine or something. And many of those patients, you can pull that tooth down just to get people confused, those patients have had bypass surgery. And they get a dental issue because the calcium goes low and they got a lot of vitamin deficiencies. So we talk all the time about getting your mammogram and getting your colonoscopy. We're worried about cancer. But every once in a while, you need to go see the dentist. Now, I don't think you got to get your teeth cleaned every 6 months and stuff, but I mean, you got to get in there every once in a while, or you're going to end up with a mouth full of false teeth.
Good dentists like Dr. D is very academic, and they can
Now,
see
I wasn't going
nutrition.
to advertise for him, but Dr.
Well, I didn't say his full name, but anyway, he's pretty good at spotting deficiencies.
Stuff, yeah. He can see stuff, and you get the ulcers in the mouth, and you'll see people, right? He'll sit them across the hall, won't he?
Yeah.
All right. Well, this next question here isn't going to take quite so long.
Hold on just a second there, sir.
All right.
I want to thank Georgia Cancer Specialist affiliated with Northside Cancer Center for this segment, and we thank you for your questions every week. No, I'm sitting here thinking because, when you go to the eye doctor and you go to the dentist, you think you don't realize, or I don't realize really all the things they're able to see and tell that you guys need to know
They
about.
can make diabetic, high blood pressure diagnosis and everything else in the eye.
Exactly.
Yeah, guy's 45 years old and can't see too good. Hadn't seen a doctor since he got out of the army at age 22.
Right.
The eye doctor can tell him he's got high blood pressure, diabetes right in his eye. All right, the next one. This is a good question here. My wife is 39 years old, and her PCP sent her to a hematologist for low platelets. He did a breast exam and found a lump. Now that sounds kind of funny, doesn't it? Except that hematologists and oncologists, when they see patients, they've got to feel the thyroid because who knows when the lady had her last breast exam. He sent her to a breast surgeon, so we don't even know about the platelets, must not have been much. And a biopsy was done and was not cancer. A follow-up at 6 months was suggested. The lump is still there. And now the surgeon suggests another needle biopsy. Should she have the lump cut out, or is it okay not to remove it? Well, first of all, that gets to the point where the options of what to do should be discussed with the patient. The patient makes that decision, but the advice is to stick with the needle biopsy, and I'm going to go through why that might be. But if after hearing what I say and what they say, this patient wants that lump out, they're going to have to fight with the insurance company to get it paid for, another thing Ray and I can argue about. Okay, put that first one up because this is kind of interesting. This woman is 39, so she never had a mammogram before. If you look at these new breast cancer screening guidelines, it says start at age 40 in patients with high risk, start at age 45 if they just don't have any risk, and then the whole list of things down there. And that's somebody else trying to tell you, it says at age 55, consider stop doing mammography. Now you can pull that down. There's not any reason. There's lots of places that they'll tell you that you treating people biologically. I had a patient yesterday who's 95 years old and is as smart and as good a shape as we are, a woman, and if she'd stopped doing mammograms at 55, that's half her blinking life. So you can't just follow those directions. All right, put that next one up. Once you talk about a breast lump, everybody's mind fixes on cancer, doesn't it? Doesn't it? Pull that down. Most breast lumps are not cancer, are they, Ray?
Nope.
There's something else. Well, I think that's the situation you've got here. We got to have an algorithm for BKP, so there it is. Put the algorithm up for BKP.
Yeah, I can see that. Although I forgot my glasses today, I can.
Yeah, all right. Well, basically what it tells you is you got a spot. You got a mammogram. If it's clearly malignant, you go in one direction. But if it's not clearly malignant, there's bunches of things you can pull that down. But clearly this woman, they did not think it was malignant the first time. They got an ultrasound and they decided to biopsy it. It was benign. We don't know what it was. Put up that next one. Non-malignant lumps that are in the breast, particularly in this age group, are often fibroadenoma. That's the lumpy, bumpy breast. Many women under age 50, once you start getting close to menopause, then those breasts become more atrophic. And then these cysts in there generally will get bigger and smaller through the menstrual cycle, but if they get any size on them, they're going to stay there. So I don't know whether she had a fairly prominent cyst or a fibroadenoma when they biopsied it the first time. You could pull that down if you like. It's entirely reasonable to believe that the mammography, the ultrasonographer, and the breast surgeon, this was a breast surgeon, if they're happy not taking that lump out and doing another biopsy, then I would say, for goodness sake, do the other biopsy and observe it. But if you are specifically bad to be nervous, then talk to them about doing a lump. So I want to show this next one because people are kind of don't know what we mean by this. But if you see this, what happens when you do a biopsy is you take that little probe there that they rub over your gallbladder when they think you got gall. It's called an ultrasound, and with that you can absolutely focus right down on where the thing is. And then somebody who's not scared of the needle goes over on the opposite side with Novocaine, puts that needle right where the ultrasound says the thing is, and then you've got what you're supposed to be getting there. You can pull that down. So at the end of the day, is it okay not to remove it? And the answer clearly is. Otherwise, I don't think that a breast surgeon, a mammographer, an ultrasonographer, and a pathologist, you've got 4 people already who say biopsy it again. I think it's reasonable to biopsy it again. But if she's scared to death and wants the lump out, then you've got to fight with the insurance company, who quite likely will deny it.
You made an interesting comment there about somebody who's overly nervous about things. This may be a good pivot. When I was in my first years of medical school and training, the tobacco industry was still telling people that tobacco did not cause cancer.
That's right, and doctors were on the ads.
And doctors were on the ads. And they were very big marketing. I mean, a lot of the budgets for ads people came out of the tobacco industry. The ability of an industry or media to tell people something and people to believe it is profound. Otherwise, they wouldn't be paying that money. Insurance companies nowadays tell you that they exist to take care of your health. It's a joke.
Yeah.
But they tell you that. Am I right? Every day in and day out, that they're here to take care of your health. Well, damn it, they're not. They're there to make money. And that's fine. They can make all the money they want, but they need to quit lying to people.
$18 million bonus the United Healthcare president got last year.
Yeah.
You know, you've been doctoring so long. You know how long you've been doctoring?
I don't know.
When you started, Fred Flintstone was smoking.
All right.
Yeah, Wilma. But
Sorry about that.
yeah. So but where am I going
Made
with
me
this? So
smile.
my point is that in our earlier point, we made the statement that people need to pay attention to their health care and pay attention to their health and listen to themselves and seek help when they need it.
Absolutely.
And take that responsibility and don't let some mental thing about, well, I don't have insurance. Well, yeah, you've got money that you put aside from not having insurance. Go get it taken care of and be self-responsible for, you know what, my intuition tells me that this is not just a benign lump. And if you've got to push the issue, get it out. I'd much rather trust you with that. Yes, you went to the specialist. Yes, you asked the advisors, and they said, no, you don't need to. But your heart still says this is not right. Get it out. So, I mean, that puts the thing back on to empowering people and giving them what I call their agency to say, yes, I am going to be responsible for my health, and I'm going to get this dealt with. Is that fair?
Totally agree.
Yeah.
I mean, as I've said a million times to my patients, I'm treating a human being. I'm not treating a chart.
Yeah.
Here's what we see.
I'm not treating a chart. I just want.
Well, I'm not treating a chart.
I got that.
I
I
treat
like
a
that.
human being.
Mhm.
And so first thing I do, I have a very lengthy history, and I get some sense of their value system,
Yeah.
what they think is important. And then I give them the information.
Yeah.
And then I say, I will honor your decision about how you want to be treated. Let's just go. Let's talk about this. What's the name of this virus going around now? I forgot.
It's funky virus.
Let's
just call it the funky.
It's
The
called
F virus.
Spanish flu.
Now we're on Delta.
China
and
virus. Okay,
The
China
F virus.
virus. All
Yeah.
right. I got patients in my office every day, cancer patients on treatment, old and overweight. Now, if there ain't any more fine China than that, who do not want to take the vaccine. I give them all the information, and I honor their decision. I don't browbeat them about it.
Mhm.
And the next time they're in the office, I raise the flag again. But I don't browbeat them about it, and I honor the decision not to do it. And I think I've got patients that I know we can help with treatment with malignancy, and they elect not to be treated, stage 4 malignancy generally,
Yeah.
because they don't want their wives to have to drive them back and forth. They don't want to be diminished in any way, and they want to go down to Florida and go fishing and let the Lord call them home. So once I've given them the data and said, look, you'll be in here once a week for 6 months, but you got a 45-50% chance we can get you back to like you were before, I said, well, not worth it. I've lived my life. I'm ready to go. Let me go to Florida and go fishing. Well, you got to honor that. That's empowering.
I love that phrase you just said, that you're treating the person, not the chart.
Yeah, human being, not the
I
chart.
treat the human being or the individual in front of me, but not the chart. And we've got a whole industry here, and I'm not just trying to beat up on an industry, and this is not conspiracy. They're working the chart to see what they can not pay for.
Or they're telling you with an algorithm that
what they
you've
will
got
pay
to
for.
follow that
Yeah.
algorithm
Yeah.
and do this.
Well, let me say this, since we're talking about it, and this is absolutely, there's nothing negative in my saying about the next generation of doctors. But you sit down in a room, all right, and someone comes in, man or woman, and they roll in a little cart and there's a computer on there. Well, I have a computer. We're all today working off computers, and our phones are computers. And this individual starts going through a list of questions and typing in your response. Okay? And then you sit there in that room, and what is actually happening is a doctor is sitting down at a portal before they come in your room, and they're reading those responses. And they start doing the figuring of, well, his insurance won't cover this, and his insurance is going to be okay with that. And they go through that. Now, you tell me where I'm wrong.
No, you're not
and
wrong.
then they come in and they start going down through what you're there for that day, and then they try to figure out what will fit for you, a prescription for you today, based on what they read in that portal before they got there.
Well, Brian,
How am I wrong?
No, you're right, but what you're indicting our current medical education, because when Bill and I were in training, we did none of that.
I get
And
it.
you never
I get
ever, you went in the room, you talked to the patient, examined the patient, came out and made
You
a thing.
took their clothes off.
Yeah.
Whoa,
And
easy there.
Yeah, well, wait a minute. We took the clothes off, put them in a gown, and examined them. There are so many patients I see today that have not had a breast exam or a prostate exam, and they've been going into the doctor's office for 15 years.
Now, I want to make sure I'm very clear with anybody watching. I understand what you said. I'm indicting that, but I these are good doctors. These are not bad people, but it's the doctor of this generation, and it's
a system.
Right.
But Bill and I commiserate with each other is who's going to take care of us when we get old. And we're not old yet. But we don't
I am.
we don't know. Because I'd be damned if I think that's an acceptable attitude. And I'll tell you what, I see it right now in this whole
We're sort
China
of taking
virus
care of
thing.
each other here,
Yeah.
you know.
It's whole, I will not be treated by someone who looks in a cookbook. And it's just unacceptable.
Well, now my wife looks in a cookbook and really can cook.
Well,
but I'm not going to let her direct
Well, wait a
my
minute.
chair.
You know, what have we talked about for over a year now? The three of us here. I had to hear a story this week, and when I say I had to hear it, I don't want to hear these stories. I had to hear a story this week where a person is at the end of life, colon cancer, and it wasn't taken care of. In the last year and a half, it wasn't taken care of.
Yeah.
And this person's at the end.
Well, I'm seeing those frequently, and I've mentioned it here before.
But now, so many things with cancer, colonoscopies and whatever, they're being considered elective procedures.
Yes, and they shut them down.
And
about
they
2
shut 'em
weeks ago,
down.
and they're talking about reopening for them in
Right.
last week of November.
And then the fear that has come with the virus, okay?
It's lost all of our human wisdom. I mean, I said this early on, 100 years ago, 120 years ago, if the government said to the farmers, which were the majority of folks out there taking care of us, you need to go home and hang out in your living room and listen to the radio and quit farming, they would say, well, hell no.
I can't eat.
Oh, yeah, I know what happens 6 to 8 months from now if I follow your frickin' advice.
Yeah, there'll be no crops.
There'll be no crops, and I know what starvation looks like. So, what happened to us last year when the government came out and said, well, everybody needs to shut down and go home and hide, in 2 weeks we'll flatten the curtain, all that kind of BS. And then they kept it down, they kept it shut down, kept it shut down, kept it shut down. Now they want to shut down again. You got whole countries where they're locking them down. That is a death, a cultural death that's occurring there. It cannot work. And we've lost our wisdom to say, no, that is just ludicrous. Now, you may feel powerful and you may think that you're God's gift to creation, but you're killing people. And that's what they're doing.
Well,
I'll
tell you what.
I got to put BKP to work again, because here is the percentage positive.
15.7.
Now, what was it last week?
Like 18?
No, 20.
It was 20. Yeah,
Right.
I know that's down.
July
That's
the 1st, it was 1.
Right.
So we had a surge, it got to 20. So in 1 week, it's fallen 5%. It didn't fall 5% because it locked down, did it?
No.
It fell 5%. More people got vaccinated, more people got it, and then got better.
Got over it.
And there's not any sense in shutting the world down when the number fell 5% in 1 week.
Well, let me say this. Yeah. I watch throughout the week different media sources because I study them. Okay, that's part of my job. I study media sources, and the fear. And I don't want to. Don't take this wrong. I don't want to debate this because I understand how big a city Houston is. This is a big city. I understand how big, Newark is, how big New York City is, and so on. And we have medical facilities that, yes, they're going to get stretched at times, and yes, they're going to have to call in some temporary sources. But you have a medical facility call in 2 morgue refrigeration trucks, okay? And all of a sudden, according to the media, that from sea to shining sea, every hospital in the world's got a morgue truck in the back because they're coming through the front door, they're dying, and we got to put them out in a morgue, and our local funeral home can't handle it. That's what you were led to believe. Now, on top of that, then the hospitals, okay? Now,
they're full.
well, but that's what you're led to believe, sea to shining sea. Oh, okay. And it's not everywhere. No. It's not everywhere. And I'll tell you this, it's such a fear that I left here, and I don't want to say this is too personal, but I left here last Friday. I did not feel well. My back, and Friday.
Adult beverage truck.
No, that wasn't. Yeah, better not be an adult beverage.
Why? I can just hear it. What was it?
It said septic.
Oh,
you sit back. Let me finish my story.
I didn't see it.
Holy that was not an adult beverage.
That was a political truck.
Yeah. So anyhow, anyhow, Friday night this happened. My wife said to me, she said, "Do you think I need to take you to the hospital?" And I said, "Hell no, you're not taking me to no hospital."
We'll call you PCP.
But no, that's
he did.
That's Oh! No, but what I'm saying is, I said, she said, why not?
You've been
I said,
scared of the hospital.
I said, I'm not going to no hospital. I said, what they try to lead me to believe out there, I'll leave that hospital alone right now. So, I mean, that's just wrong.
It's wrong.
That's just wrong.
Yeah.
You know?
But, I think we have a turning going on. We have people waking up, and we have people saying no and hell no. And they're going on with their lives. And they're pushing back now, and they need to push back. And
What's
they
going
need
to
to say,
happen?
we're American.
What's going to happen? I don't want to. We can't do politics on here. Northside won't let us. But what's going to happen if they mandate with any kind of teeth? I don't know who's going to enforce it. Some of these things I've heard in the last 48 hours on the television and the radio about forcing employers to get everybody in their 100% vaccinated or do once a week screens. Are the once a week screens free? I mean,
well, I don't know.
Well,
but they do nothing.
Well, I'm just asking
Yeah.
a question, though. I don't know how the pay. I know that if you go over here to Georgia Mountain Health and you get your screening test
you go once-
and the shots, you'll get that for free, right?
No, well, if you go to the drugstore and do the on-site
They go
screening, you're going to pay $80 to $100.
But you know what, gentlemen?
The program is basically free.
If they
through
send
these-
it off and you get it back in 2 days, it's free.
Gentlemen, I received a call yesterday afternoon. The person says to me, how much do you think those over-the-counter tests are? And I said, why? And they said that this person says, I want to go to this concert. And I need to take one of those tests to go. I said, so you're actually going to pay for the ticket. And you're going to pay to prove to somebody also over and above, you're going to pay, right? And you know what this person says? At work, we got a source. We can start buying our vaccine credentials.
Ooh, I don't like that.
No, I'm just saying this
They'll
is
go to
what
jail.
this is. But this is what's happening.
But Bill
this
asked
is
the question.
real.
Bill asked the question, what's going to
But you
happen?
understand what I'm saying?
But there's
These
going to be
kind of
more and more
things-
pushback, and it needs to be. It needs to be. The American people need to say, look, you don't get to shove me around. You don't get to tell me what to do with my body.
The other thing is that you can require, if you have a bilingual business, that the people that work for you speak Spanish. And if you're in the airline business and you fly to Russia, you can say that your flight attendant on that flight has to speak Russian. So the employer can have requirements that relate to the occupation, and since they have a public health issue, the airline has the right to say that you should be immunized or tested every week. I'm not getting into the $200.
No, you're a world traveler.
Yeah.
You've traveled
Everywhere.
You've traveled extensively. You're a world traveler. I've done a little, but I also remember when I traveled, there was in a couple places, there was a list of shots I had to go get before I could go.
Well, that was to protect you from yellow fever. That
Right,
was
right,
not to
but there-
let you get into the country.
I understand,
Yeah.
but there
was
was
a list of shots,
and a
yeah.
lot of people that try. I get that. I get that. There's times you're going to do something. I will tell you this. You want to know? Excuse my language. You want to know when all hell's going to break loose? I'll give it to you. When they narrow you down to 6 beers like they have in Australia. Now let me right? Am I?
They start checking your packages.
Yeah.
Whoa,
sir.
wait a minute.
Yeah.
Oh yeah.
Yeah,
What's the
Australia.
story? Oh,
Yeah,
I didn't hear
right?
that one.
Australia is under martial
Well,
law.
no,
Yes.
you didn't send me anything about the 6 beers.
No.
I saw
If you
about the
have
poor lady.
alcohol delivered to your residence,
Yes.
you get so many bottles of wine and so
Yes,
many
sir.
beers a week.
Yes.
And
I didn't hear that. Now I got to tell you, I saw that guy on the. my
now,
wife
those
sent
are
it to
fighting
me.
words.
Yes,
now.
exactly.
My wife sent that guy to me that was in that village that they have. There's a village where the people were sent that were being quarantined at government expense. They paid, they're feeding him and everything, and he was sitting there with a mask on. Says they're coming and bringing the food to us right now. What now? Whatever he says, I can't got an Australian accent, and it's terrible food. And then he's pointed out that the woman across the hallway had come down to pick the food up at the curb without a mask on, and that they arrested her. Yeah, did you send that to me?
When you
Well,
like
anyhow,
to see
wait a minute. I was offended by that, but I'm a lot more offended by the 6 beer delivery to the guy. That's even worse.
Hey, I tell you what, I like to see him tell old Crocodile Dundee he can only have 6 beers.
Pull out a knife.
This is a knife.
But I like to see some of these good buddies that I know over here on Sunday watching football.
Well, we do have a Second
6
Amendment
beers.
in this country, and that ain't happening.
I'm
You
just
think they could get away with that on cut cane?
I'm just telling you. I told you where it's going to end. What do you got closing? I've got the All-Star political panel.
Oh, I'm
over
good.
here.
I'm good.
Are you
Appreciate
good?
it.
Yeah, I'm good too. I still go back to the fine china. Offer the fine china,
I do
the
too.
immunization.
I do too. I agree with that. Let's take care of mom and dad and our seniors, and let's do that. I'm pretty sure, knock on wicker, that we have all of our high school football games tonight. So
Very
Well,
good.
that's a first.
well, let's say this. I know we're closing, but you have on one television screen, they want children. LA school system voted yesterday that every child in Los Angeles school system 12 and older has to be vaccinated. Has to.
Ain't gonna happen.
But that's what they voted. Now, you've got kids in masks going to school on this screen, and over on this screen, you got 80,000 up there saying "Go Dogs." We're gonna end on that.
Thank you, Northside.
Enjoy this nice, crisp Friday night air for high school football and college Saturday. And thank you, Georgia Cancer Specialist, Northside Cancer Center, for this segment. We're going to take a brief break. When we come back, we're going to have the All-Star political panel with us.
You got a dog? Is there going to be a pet?
Rena's sick.
No pet of the week.
She's sick and
All
can't
right,
do it.
take us off now.
Anyhow.